to unmute you, Lara.
Hi, I just realized I'm Dr. Lara, not Dr. Lara Maier, Dr. Lara.
No, you are Dr. Lara.
Dr. Maier.
I'm hoping I've sent Jeremy the right link. He might be getting a link to our daily sync on Monday, which would be very lonely. Let's hope that you'll get here. Also, some people in the chat.
Cool.
Let's see who's there. Yes, we can see you, but you can't see us. Okay, so maybe in the time that we're waiting for Jeremy, like, what has been your highlight in the past months, guys? I know this is a weird question, maybe even hard to specify, but I think it's important that we remember the highs, especially at a time like this. Is there anything that you wish to share that is appropriate of this context? Of course, if it's something like getting a cat, I think there's also relevance there. Why not? Or maybe company-wise, that would probably be more.
Well, that actually is a lot easier to say, but I mean, the last months we all went through a Corona pandemic. The world got upside down. Our life got completely changed. So everything changed, but there also have been highlights. Also, like in a private way, like life became a bit slower, and you had also like more time to think about what really matters to you, which I really liked. And company-wise, I mean, I must say I'm working for a digital company, and we are doing telemedical projects or concepts for clinics. So of course, a highlight was that finally everybody was looking at us and asking for our help and support, and we like doubled the size of our company within 6 months. So I must say this definitely was a highlight, that the audience was there finally, and they understood why we're doing this and saw positive impact.
That's indeed very good news.
Yeah, definitely.
Prizes as a chance, right? Yeah, I mean, I'm also working in digital health, so of course there were obviously some good developments in the last month, but from a company perspective, probably from our team perspective, we could address the challenges so far also of remote working quite well, and I have the feeling that doing team building in these remote settings, I mean, we were always having different sites all over Germany, but this was something I experienced as very like bringing us together and working on this challenge together. Yeah, really trying to address the crisis in a positive way. This works quite well so far and helps us to really form as a company and grow.
Great.
What was your highlight?
Sorry, what was the question?
Like, so still waiting, Bijan, what was your highlight?
Yeah.
I would have to say the same. I think as a company, you sort of grow together on a very different level. Personally, I have to say that I'll do the short intro on Intertek in a second once Jeremy gets here. But I think as a company, we obviously have realized that the health tech sector is an exciting area. For us, we're working with a number of companies there. And we're just like extremely happy and grateful that we can help out, especially at a time like this. And this is also the reason why we tend to, or why we want to continue hosting these events in order to give back from a content side and also from a discourse side. And maybe something will happen, maybe something will not, but that's the point. Let's push on to Moscow, as Napoleon would say. Jeremy is cutting it a bit. It's cutting a bit close now. We're already 5 minutes in. Maybe I'll start with a short intro on us, and also thank the audience for being here. Thank you very much, guys, for spending your Tuesday night with us. I understand you must have a lot of things on your plate. Actually, no, you don't. It's COVID. But thank you very much for being here. My name is Bijan. I'll be your attempted moderator for the evening. A quick intro on the host company. Intertek is a software development company in Munich. We work with startups, scale-ups, SMEs, and corporations to help them ideate, conceptualize, develop, build, scale, and maintain their digital products. We are now a company of around 120 plus analysts, developers, and engineers, and we work across a broad range of industry domains ranging from logistics, manufacturing, sport tech, health tech, e-commerce, and so on. In the call with me today, Dr. Lara Maier and from CASPAR Health, and Dr. Lutz from Ali. Jeremy would also be here, and I think he might be here in a second. But let's move on for now. Maybe you guys can have a short introduction on yourselves and maybe how it links to the meta-level topic of this round, on how you're trying to improve the patient experience. Also, if you think throughout the event if you imagine that I'll be having a beer, you're quite right. I am having a beer. So cheers to all of you and cheers to the audience. Over to you guys.
Anna, you want to start?
Sure. Yeah, so as already said by Bijan, my name is Anna Latz. I'm a medical doctor by training, certified in the fields of nutrition and currently also in lifestyle medicine. And I also have a background in business and systems neuroscience, where I did my doctorate. Here's Jeremy. Welcome. And yeah, so due to this background, I have quite an interdisciplinary path so far. So the common theme, I would say, is education and communication, all in the field of healthcare. So I worked in the clinical sector, then joined a startup working in Germany and the US, then had some bureaucratic insights in the political field, working for the Federal Center of Health Education. And after that, joined Ali, where I have my current position now as Chief Medical Officer. Yeah, and the link to the overall topic is what we are doing. So we are pioneering value-based healthcare in Germany, thus putting the patient experience, human experience very much to the center, and encompassing being a companion to patients along their journey. So I can elaborate a little bit more on that later on, but that's for the start.
Thank you very much, Anna.
Thank you, Anna. Then I would just continue to introduce myself. So Dr. Lara Maier, my name. Actually, Anna and I, we have known each other for about 2 years now. And so my introduction is quite similar to her. I'm also a medical doctor, and I also specialized and certified in nutritional medicine and lifestyle medicine. So there are some parallels in our lives, which is also the reason why we know each other. Further than this, I was and still am active in an NGO called Hacking Health. We organize health hackathons for young people who want to, or for people who want to engage in the healthcare system, got a good project they want to put into real life, and just need support from interdisciplinary teams, which was basically my start into the digital health scene. And yeah, since I've been doing this, I could dive into the digital health scene in Berlin mainly, and did see my future here and the biggest impact to improve the healthcare system after all, which is also why I decided, after working at the Latz in Munich and the Charité in Berlin, I decided to focus only on digital medicine now and become like a digital doctor, you can say. And therefore, last year, like exactly 1 year ago, I joined my current company called CASPAR Health. CASPAR Health is taking care about the digital, it's like a digital rehabilitation platform. So we are taking care about digital rehabilitation plans and therapies for patients, which means they can remotely do their rehabilitation and do not have to drive to a hospital or an ambulance rehabilitation center every day, which is a massive improvement for them, since they can combine their daily life with family, kids, and work, but still be able to join the therapy, which they weren't able to do so before. So yeah, my main focus, and as I said, like the main topic for patient experience and patient digitalization, I would say the digital rehabilitation, which offers a massive improvement for patients in my eyes, and then also my personal focus on digital prevention could be a good topic for tonight and interesting impact.
Thank you very much, Lara. Jeremy, you've joined us in the meantime. Can you hear us? Can you see us?
I can see you, I can hear you. Finally, everything works. I might be head of digitalization and innovation, but You see, digital tech is not my topic. I'm more or less the user connecting the dots, but not the guy who's programming the stuff and getting the things ready. So my topic where I have to improve.
It's not a problem at all. Would you like to? So we actually moved on a little bit ahead of you. So I did some intro things. Anna and Lara introduced themselves. Maybe you can give the audience just a short brief on your journey and what you're doing at the Johanniter. Expand it up on what you just said. Sorry.
I'm happy to do so. So I'm head of digitalization and innovation at the Johanniter. The Johanniter is a German hospital provider. We run 8 acute hospitals, 7 specialized in rehabilitation hospitals, some clinics, and around about 97 elderly care homes. So the Johanniter is in order, established 900 years ago, and for 900 years we are taking care for patients, people who are kind of suffering, and we want to help them. My role is totally new at the Johanniter. I'm focusing on fostering digitization together with the IT department, and also establishing digital business models for the Johanniter. Before that, I was working for Curali, the digital arm of Helios Fresenius, did also a lot of board projects, and before that I was more than 7 years with Axel Springer, one of the biggest European media houses, and mainly focused on in-house consulting and digitalization.
Okay, thank you very much. Thank you very much for the introduction. I would say we have 45 minutes left. Let's dive right into the topics. We have 3 main questions, which we can obviously break down a little bit further. But I would like to start off with the first one, which is, I think, an interesting one, especially because we have a lot of the spectrum of the industry here. So we have Lara and Anna more focused on the forefront, on the actual experience of the patients, and we have Jeremy as the provider. So I would like to start with what areas of digitization in healthcare do you see as the most important? And you can happily sway off from the field that you're in. Is it legislation? Is it the actual products? Is it the offering? Is it maybe like a synergy of all these players? And I think you can start, however, who wants to jump on first?
Would you say somebody?
So I think we all have quite some different insights to share. So maybe we can start with some macro trends, especially this year I experienced a lot. First of all, we see quite some decentralization of healthcare, and most of all, speaking from the German market, I would say this is something we can see and observe quite internationally. So with the rise of telemedicine, of like apps and platforms, like for example, CASPAR Health, and this going along also with the emerging of learning healthcare systems. So this is something, really on a macro level, we see more and more that we try to understand, okay, we generate data, we have quite bits and bytes everywhere, and try to put that into the real field and generate and learn from that and put it there where it belongs to the patient, to really improve his or her experience. So, and from this macro perspective, one could say, okay, there are quite some trend topics also in the healthcare fields. There are some buzzwords coming out, like for example, femtech is quite on the rise. We see quite a lot of initiatives also in the field of mental health. So, but I think everybody can agree that we have quite a lot of spot solutions from different indications coming up this year. And so this is more from the provider or startup world, but then of course, and I think we dive into that a little bit later on, also what's going on from the legislative side. There's quite some interaction coming into place. So from my perspective, all these initiatives and also the macro trends all lead to the rise of personalized approaches really putting the patient experience or better the human experience in the center and trying to improve the journey.
Jeremy, you next to me next. Who wants to follow?
If you ask me, then I start. I see a major change is ongoing on regulation. And I think regulation is one of the biggest topics, because in the past it was very difficult for all the innovative players and digital health companies to get reimbursement. And without finding its way into integrated care, this was the biggest impediment, because now or still on, patients are not that eager and not that experienced to pay by themselves over the counter. So it was more or less relied that insurance companies are paying for that. And I think this is a good connection for Lara. The first real kind of digital health regulatory change was the telerehabilitation aftercare, as it was the blueprint for the Digital Care Act, which is now in place, slowly upcoming. But it was the first reimbursement where you found kind of a win-win-win strategy, because now rehabilitation facilities get paid 6 to 12 months longer if they treat patients afterwards. CASPAR Health, who provides the services, get part of the reimbursement. And this is the biggest topic, that we as a provider, we make money more or less from insurance companies. So we want to treat patients. And if we want to use digital solutions, which need to make money as well, we have to find a way to give money to these companies without saying, but who pays us, or where is the margin for us? Because otherwise this is a big topic. And I think if digital health gets now reimbursed, it helps providers, doctors, to really subscribe digital solutions, digital therapies, and improve the lives of patients.
Yeah. So I completely agree to what you said, Jeremy. And as you're very right with the reimbursement of a digital therapy, digital rehabilitation therapy. Obviously, that's what made CASPAR big, and it's all about the system and regulations, which are a massive factor if digitalization wins or loses after all. And I think a very important fact we have to keep in mind if you think about which areas are going to be important, which is where digitalization going to help, is that wherever digital project or the process of digitalization can improve a situation and solve an existing problem, I think that's when it's going to work. So if we think of existing problems, and there are many out there, as we all know, if a digital idea can actually solve or improve the situation or problem, then it's going to work out, and it's going to be an important area where we can see disruptive change even. And one other factor which I think is quite relevant, it isn't even that related to CASPAR, but it's like a relevant factor of where I think which is going to be important for digital healthcare, is also for like a hospital process, like AI digital process in hospitals, to support physicians' daily work in terms of digital supported diagnostics, for example, but also for the nurses, for like digital therapy support for medication plans and treatment systems. This will massively be able to improve the therapy outcome, because just less mistakes will be made by humans, and will be more like accurate medication, more accurate radiological diagnostics, for example. So I think like the digital hospital will become a very big topic, because it will lead to better patient outcome after all, for sure. And another topic which I think is going to be super important is and my personal favorite is the topic of preventive and precise medicine. As also Anna already mentioned, like collecting and analyzing data, of course, will, after all, lead to more precise therapy for sure, also in terms of medications, for example, but then also in terms of more personalized therapy for the patient in terms of the because you can, with a combination of digital tools and platforms, for example, doctors will be enabled and health coaches will be enabled to accompany the patient on a long journey, doing like a private health coaching, more or less, on a remote digital way. So it's like more efficient, but also personalized, which I think will be the clue to, I will always call it like prevention made digital. The somehow becomes a realistic opportunity and can, after all, massively improve patients' journey and outcomes from my point of view. Thank you.
Super interesting and relevant. You started mentioning it already, Lara. I think you, Anna, Zoe, and I believe you, Jeremy, as well, which actually, like, it moves us to a next question, which is, I guess, probably one of the most important and exciting of the evening, which is, how can we incentivize this adaptation a lot faster? How can we incentivize the state? What can the startups do on the technology side? What can the providers do themselves? And what can the state do to incentivize the adoption of these much faster than what's happening at the moment? Or is it even possible in Germany? What do you guys think? Or actually, let's turn it around. How can we incentivize investors to pump more money into the system? It's a bit of a,
I'm not sure if this is
it's a bit of a risky question, but maybe not the wrong approach, or the appropriate approach. Let's put it this way.
I would say money is not the problem yet. There's so much money floating around. I think with the Digital Care Act, we are in Germany really a game changer. We have to now see how it plays out, how many companies can find their way to integrated care. But another big step which is missing is education for doctors, education for clinics, also for hospital providers and the patient, because now we have a lot of physicians having still problems with proprietary systems, so the IT infrastructure is not that well organized, even in big companies as the UNITA. The hospital information system or the clinic information system is kind of old-fashioned compared to nowadays standards in a way. So this is the big problem. We don't have good APIs in our hospital information system. The service providers of the systems refusing to work with innovative players because it's, of course, an attack on the business model. So what is now in play is reinforcing the hospital information system providers, opening up their systems, reinforcing it, establishing IHD, FHIR, and all the other APIs, fostering a collaboration with innovative players, and education for physicians, nurses, and patients is one of the biggest steps ahead of us.
Yeah, so if I can add on to that, and I would like to pick up one of the first sentences you said, Jeremy, because this is something we see in our practice every day. So I can share some examples also from the field, because if you think about what quite an innovation or what a revolution it is that in Germany 73 million people are entitled to get really an app prescribed, which you would say it's great and everybody in Germany should be really thrilled about it. But what we see is that especially the providers, the care providers, they they're either resistant or they don't even know about it yet. So education really is key, and we more and more see that health literacy and e-health literacy, if you want to call it like that, is not mainly a problem with patients or users of the products, but very much also on the care provider side. So it's super interesting to see, because when we go to hospitals, we collaborate with the ambulatory, but also stationary sector. And if we go there and we talk about the DIGA and the prescribable apps, nobody has ever heard about it. So, and this is big hospitals, this is all over Germany. And still, I mean, we are, of course, on our filter bubble, I'm very interested in that field and I get all the news about it. But still, you would think, okay, there needs to be so this gap needs to be closed. And coming back to the question, how can you incentivize then? Of course, first of all, the question, whom do you want to incentivize? From a startup or innovator perspective, of course, you want to have your users to use the platform, to use the app, to be involved, etc. But this is not really, at least from my experience, in my opinion, the problem. Even patients aged 60 and older, I mean, there have been recent studies that 2 out of 3 people in Germany use health apps in some way, and it's not only the 30-year-olds. But where we really have to think about how to incentivize is really the care provider side. There we have to go into really their world, and this is what I know from, of course, a little bit from my practical experience, but most of all from the surroundings of people who work there. It's all about the workflow. It's about, yeah, the infrastructure, which is not up to date yet. It's about change management, changing existing processes. So I think incentivizing can be very easy when you understand the world you're addressing, why there's resistance, because most of all the resistance is because there's a misunderstanding that somebody wants to replace you, but not augment you. And all this can be solved only by educating and also, yeah, just sticking with it a little bit and really waiting until the change kicks in due to legislative changes, etc. But this is probably the hardest part also, to have the care providers on the side, not only the early adopters.
Yeah. So then I completely agree and to what you said, or to what both of you said. And speaking about incentivizing, I think it's not only about incentivizing the patients, it's also about incentivizing the doctors and the medical staff. If they have to be eager and keen to adapt and implement digital process, because if they do not promote any digital change, a patient won't be interested or won't believe in this change. So I think it's obviously you have to focus on patient-centered project and patient-centered outcomes, and the patient has to be like in the center and in the middle. But then also you have to keep in mind if my physician next door is anti-digitalization, he will never ever give me a DIGA like app of WhatsApp, because he won't care, and then also he won't have a digital practice, for example. So I think just 2 things to add on what you said before is the one thing is I think either insurance companies, healthcare insurance companies, or the state, like government processes, should pay somehow or find financial structures to also like cover maybe implementation costs and the developing process of, let's say, a digital practice, like to support the doctors in going and leading that way, and not only pay them and reimburse them once they do the final digital treatment, but maybe even before, to incentivize them actually going off and like going on sailing boat and sailing to this new direction. And then also two important things one has to think of. I just wrote actually an article about the DIGA and the acceptance of DIGA at medical staff and for physicians, and the acceptance is very twofold, or like it was like two sides of this. They were all interested in it, but they didn't really know about it, and you could see that they are interested on the one side, but they don't have the time to get the information and to really take care about it. But then, of course, the big companies, the DIA is coming, they're coming anyway. And if the doctors don't support and lead the way, they will be overwhelmed pretty much. So I think a quicker adaptation of these new technologies will also be possible if the one thing of medical staff is going to be open for it and is willing to lead the way themselves and to shape their own future. But then also but the stakeholders have to actually get to know their customers, let's put it this way. Like a DIGA company, if I want to be a DIGA, I have to know who I'm going to work with and make them understand what my product actually is. Otherwise, they won't use it. That's what my outcome out of this article was, and like a little study, like Umfrage I did with a couple of doctors. Mm.
Yeah, maybe just picking up this very last part, absolutely agree on that, because you really, I think I could imagine that the problem for most of the companies having very good, sometimes spot solutions and great ideas, that they do not really understand the world they are entering. So the theory and the great idea and the process that's not optimal, and then you have to bring it into practice somehow. And if you don't have a change agent in the hospital who really drives it for you, who's really really fostering your idea as well, then this is super hard. I'm not 100% sure if we need some financial incentives for the care providers, but I think the key is to address them in a very clear way, not threatening any role, and be very simple, like providing a simple solution, one-two-click solution, and immediately showing that the process outcome is better, because what most of the physicians are lacking is time, and time they want to spend more with patients. And if you improve the process somehow and do not bring in extra work and then an extra app and then an extra solution, then you get acceptance. And I think it just is a process. Of course, you will have some early adopters. And also from our experience, when you have the doctors on your side who really understand the benefits, for example, being also some refined data and information they get about your patient, understand their patient, understand why they are better or not so good, then they work with you, and they are the best innovators you can have on your side.
Which is amazing. Yeah, just like one last thing to what you just mentioned, about the doctor. Like, it has to be easy. Like DIGAs have to make their life easy and less complicated. I 100% agree to this. When I wrote this article, one main point or one main factor, they all said that they will only subscribe DIGAs if they don't have to take care about the technical maintenance. So they are scared of being the technical, like the IT guy, that if the patient has a problem with the DIGA, they will come to the doctor and they have to help with the app. Like, if this is the case, I will never ever prescribe this DIGA. So very, very right. It has to be easy for them and no extra work.
Okay, thank you very much, guys. Just so we have a question, actually, and it actually does fit in quite nicely with the topic of education. I'm just wondering whether we save it for the Q&A session at the end, or would you like to address it as it comes? I think that might be very exciting, because I think in terms of the context, this question came from Johanna Bobart. Hi, thank you for a great overview. As a doctor, I'm wondering why only 1.2% of startups have a doctor on their team. Can you say something about that? And do you think this does something to the direction of DIGA development will take in the next years? I think it's an interesting question, because we spoke about the lack of education on the provider side or the reluctance. Do you think that having a doctor in the startup team can aid this process?
So should I start, Lara?
Yes, please, you start. I will agree to what you say anyway. Yeah.
I mean, I don't know where the number is coming from, but it's interesting, and I can imagine that it's quite a low number, definitely. I mean, why do not have many startups doctors? Because a lot of doctors are not really willing to become a digital doctor just like that, before understanding that. Before, I mean, for both of us, for example, it was quite a process, and having a more open background for years before you say, okay, I did studies for 6 years and want to work in patient care, which is super grateful and super nice, and then just leave the field and join a startup. I think most of the doctors who are in medical startups are probably founders themselves, really wanting to drive the change. But what we see a lot, and what I think most of the startups in this field do, is having medical advisory boards, having medical advisors on their side, or at least part-time, because this is definitely crucial. And this is also what I absolutely agree on, looking at that question, that you need some insights, especially, I mean, if you want to go to the field of orthopedics, you have to talk to orthopedic surgeons. If you want to go to OBGYN, you have to understand that market. If you want to go to Femtech, you need some experience for that, not only to build great products, but also to get the acceptance. And not to forget, healthcare, especially in Germany, is quite a network business. So in the different fields, the key opinion leaders know each other. And if you want some innovators on your side, you definitely need some credibility. Yeah.
Jeremy, then I'm gonna continue. So I'm actually a bit shocked and surprised by the number that it's that low, and as I don't know where it comes from, but it definitely goes into the direction which I had already the feeling of, and actually even this was one of the reasons why I went into this business, because I realized that there are so many, like everybody wants to get into the healthcare scene now, because as Jeremy said before, money isn't the problem. There's so much money out there, and everybody wants to get a piece of the cake, as you say. But they've got, like, from my experience at Hacking Health, for example, like most of the ideas, I mean, they were good ideas, but they weren't medically funded. They had no like really medical base. And one of the reasons why I left the clinic and went into the system was because I really felt the urge of a medical doctor to shape this future as well, in a way, I must say, because otherwise it will just go into the wrong direction. And but not too many people think like this, exactly for the reasons what Anne said. That's completely fine, because they want to stick to the patients, they want to engage in like really patient care, and it was a long process for us to actually take this decision. But I think it's very, very important that we do take care, and then also even the doctors, as I said, in the private practice, for example, that they rather should try to shape the future of DigaPros, for example, now, because if they do not do so, then it's going to happen anyway. So, like, yes, it will impact the Diga development in the future years if medical staff won't get involved in the process. I'm not sure if it's going to affect the companies or the startups from the beginning on, because they get the medical advisory board, so they do get some medical advice. But from the user perspective, they should rather get involved as well, for sure. Yeah.
And that's how we also got the source. Thank you, Johanna.
I was about to mention it.
Johanna, thanks for the question.
Yes, the source came from Statista, Studienfächer für von Startup-Gründern. In case anybody was wondering, we can also share that at the end. Maybe to you, Jeremy, is there anything that you want to add?
From a provider side and someone who's mentoring a lot of startups, in a lot of accelerators, this is actually very painful, because there are so many startups. Because in the past, you always talked about disruption, and people come from the outside, entering a new system and totally disrupting it. This might be possible for unregulated areas, but it's not very possible for healthcare, I would say in healthcare, you need to innovate within the system, and therefore you need doctors. If you want to talk to doctors, I don't know what Lara or Anne said, but doctors are very elite kind of people, and more or less they don't have any time, so they only want to rather talk to startups who really know the business. Maybe even doctors who know the topic can be very precise about the payment. So from my point of view, it's very important to have doctors on board. Might be advisory board, but in the end, we need really doctors when it comes to guideline-orientated solutions you are developing. But it's not only the doctors. You need to understand the patient as well, the patient pathway, the impediments of the patient pathway, And you have to start really with the problem, come with the problem you want to solve, and find the way in. And a lot of startups start with cool technology, cool products, and want then just see where is the problem they can solve with this cool product in healthcare. And in healthcare, you really have to start with the patient's problems and understand why doctors act as they act today. So doctors, patients, and insurance companies might be the biggest stakeholder in the game. And you really have to understand all three of them.
Sure.
Okay, thank you very much for that oversight as well. Just keeping that time in mind, we have 20 minutes left, and we have one question, a predictable question, as well as the Q&A left. So I would like to probably move on swiftly. I do have a sub question, but I think Anna actually answered it. Let's move on to the last question, which is actually sort of quite obvious in many ways, but it is a very relevant topic. How has COVID changed the overall landscape, and what can we learn from it? Opportunities and the challenges, the risks, and the weaknesses that it sort of even showcased, I guess.
So maybe then I'm going to start this time, as they started before. So obviously it has, like, as we all I think know, the COVID pandemic has been a massive booster for digitalization. I'm not telling anything new right now, we all know this. But still it is worth to mention it again. And what I think, or what I experience and see, is there's finally a positive acceptance for digital innovations, and I see the I feel finally that there are possibilities in politics, in patients and patients' behavior, also in the clinics, and overall you get to see those possibilities, and you feel that there's like a wind of change due to this positive acceptance, which I really enjoy, and which gives us a massive energy booster as well. Like, now finally we can do something, we can flip this around. But then also from my feeling, we saying, like, all the startups out there, all the digital doctors, all the healthcare providers who want to change something, we have to deliver now as well. To me, it feels like a window of opportunity, I would call it. Like, everybody's, like, the audience is ready to listen, everybody's is ready to follow us or to try it. But if our products, if they don't maintain quality standards, or maintain, like, if they don't actually fill a need, we obviously won't survive. So quality is still a massive, big factor. And and another thing which I think we have to keep in mind, in terms of the DGA process, which has now just started in Germany, the German healthcare market has suddenly, and for the very first time, become very interesting for foreign companies. So beforehand, we've been very regulated, which we still are, but now a bit less. So German healthcare market was very unattractive for investors from overseas, from other countries. But especially foreign companies and startups, they are pushing to the market now, since it became attractive due to COVID and due to DGA. And if we don't succeed with our quality, especially like small players, they won't survive, because competition is getting tougher.
Yep. Examples maybe from the competition being, I'm not saying it right, KRY, sorry, from Sweden, yeah. I believe. There we go.
Mm-hmm. Yeah, exactly. That's also what the example that came to my mind. So telemedicine, telecare, addressing now the German market. I mean, there's some huge players entering. Yeah. So, Jeremy, do you want to continue?
I can. One, I would say, of course, it's a big booster, but still a long way to go. As we saw, patients being paralyzed because of COVID, having big issues when too afraid to entering clinics, hospitals, people even having heart attacks and refuse to go to the hospital. And we need digital care to kind of monitor patients, help them to, in a way, diagnose themselves, help them to find the right decisions, to make the best decisions, and to help them in preventive care, but also in therapy. And of course, something when the patient is in the facilities. Now we have the Hospital Future Care Act in play, which is another big booster for the hospitals. It's the biggest fund ever established, 4 billion for the hospitals. In a way, easy to get so that the hospitals really start to digitize and to improve the infrastructure so that we can really work with all the digital tools, with telemedicine, patient portals, and prescribing digital therapy. The infrastructure needs to be ready, and also in Germany, kind of a long way to go, but with this new fund and the Digital Care Act, I think we now have really a big window of opportunity so that Germany can improve from being Medicore into being one of the front leaders in digital health.
Yeah, so I don't want to be too repetitive to the great chances we saw and see this year. I mean, we also had the example from like starting off with some cooperation with like telephone calls in the beginning of the year in January, and then seeing the hospitals being digitalized, of like having full setup video conferences by summer. So this is definitely what we saw on a very operative level. But on the other hand, so, I mean, I love this question because it opens up quite some opportunities for discussion, but to bring it also back a little bit more to a macro perspective or international perspective, of course, and this is also what Jeremy was alluding to, this year is quite a challenge, looking at public health, looking at, for example, how people deal with the crisis, also the second lockdowns now coming up. From the respect of like mental health, we see substance abuse going up quite a lot. So people are decentralized in their home by themselves. So also looking at the prevention and secondary prevention, people do not go to their regular doctor's appointment. So probably the next year we will see quite a lot of challenges addressing from that. On the other hand, we also now have the chance to reach more people at their homes. But this is something, I'm quite concerned about, also from the perspective of equity in healthcare. I mean, a lot of social determinants of health, something we are not tackling today, but this is something that becomes very obvious in the crisis, because now you're in your home, and this is very much also dependent on how much you earn, where do you live, and you're really stuck there. This is so I do not want to close with like these negative examples. So also from an international perspective, I think we have seen quite a good change management happening, and some good and some not so good examples also of leadership within the crisis. So looking at the US, for example, I think Anthony Fauci was quite a great example. I don't know if you're aware of him. He was really quite a leader for a lot of physicians, really inspiring and showing how education, something we discussed a lot in healthcare, and like being a leader in that field and really trying to bring the important messages to all the stakeholders, not only the public, but also the physicians who needed quite some leadership this year. This was a good example to see. And also coming back to Germany, I think we addressed the crisis quite well. And of course, the Digital Care Act was quite convenient from timing, being set up in last December. So overall, I see quite the crisis as a chance, as we say so much this year, from very different respects.
Okay, thank you very much. I think that was a very nice sort of all-around picture from all sides, and we've actually hit the mark perfectly for the QA. I will open up the floor to the audience. If you want to latch upon what Anna said last, or what Lara said, or what Jeremy said, feel free. Now begins the awkwardly walking or just waiting around until a question pops up, or maybe it doesn't. Yeah, just 1 second, or maybe if you want to add anything else, guys, feel free. Maybe, sorry, yes, Lara, please.
This is so I do see the one question, like how much of the health industry in Germany is actually digitalized and what parts of it are mostly covered. We can definitely start with this one, unless you want to.
No, it was a good
go for it. So, well, I don't know. No, so no, actually, I cannot tell you percentage of how much of the health industry in Germany is digitalized. I don't know. Maybe Jeremy knows, or Anna knows. I can give you a rough feeling. Like, I know every big company, every health insurance company, every clinic, they all have some kind of digitalization. They all have some kind of IT team, and they all collaborate with a startup in some way. So it is, I think it's spread all over, but it definitely is, I would say definitely less than 50%. And if like what parts of it are mostly covered, I don't know if you're talking about the, if you want to talk about the area where digitalization is mainly covered, or the area of Germany, like which areas, like if it's like a
regional?
No. In the regions.
Like a regional question?
So from region, the only thing I know, and which I thought was quite interesting, you would always think that the digital process only or mainly happen in the big cities, in the main the capitals, which is partly true in terms of like Berlin, the startup bubble, of course. But interesting enough, I know one very cool startup that has been developed in the Pampa, as you say in German, like in a very small village, and it was a particular physician, like a doctor who did his like daily care, and he decided that he wants to start working more remotely. And he developed his own telemedical kit, and he started his own telemedical praxis, and the startup is called now MedKit Doc, and he got like a very, very cool, he developed very cool tools. He bought all the equipment from China and thought about, okay, from a doctor approach, like how does this, if I want to do remotely or telemedically listen to a heartbeat, for example, like how does this this engine has to work to actually get the sounds the way I'm used to when I would speak to the patient. And so he developed a very, very cool thing, and that was in a very suburban area. And then funny enough, like the main telemedical, like the e-recept, for example, like one big project has been in my home city, which is in a very suburban area in southern Germany, in the middle of nowhere. But there are many like big telemedical projects, because I think the need is there as well.
The startup you mentioned, like MedKit, this is Florian Koch, right?
Say again?
This is from Florian Koch, I believe.
Yeah, exactly. Yeah.
We're speaking about the same company.
Okay. You know them. You know them exactly. Yeah. Florian and Ben, and they do a really good job. So I support them. I think I really like the idea.
They do an incredible job. Yeah, absolutely. And I believe they also like recently like announced their funding, which is also great.
True. So we know them.
Fantastic use of them, for sure. Just looking quickly to the crowd. Anything to follow up? I'm just going to give it maybe 1 or 2 more minutes. Maybe Anna, Jeremy, any last words? Not last words, only for tonight, obviously. But anything you want to add? Anything you want to make people aware of, maybe?
I mean,
go ahead. I'm sorry.
You're just talking about numbers. I mean, I obviously also don't know. I mean, say how far the digitalization is, or how many startups are out there. Quite a lot. I think you will find numbers when you go also for the European, and this is some 3-digit numbers, like 400 something I have in mind. But which might be interesting is if you look at the DIGA process, and the BfArM just 1 or 2 weeks ago, they said that's like 75, 80 startups they had there for counseling. At least they are interested in the DIGA process, and I think there's like 6 or 7 out now. And this is really not the majority of all the startups, because there are some prerequisites to become a DIGA. You have to be medical device, etc. But this just shows that there's quite a lot going on, and we probably need to be patient a little bit, because the process is not as easy. It's just, you don't just go there and say, hey, I want to be a DIGA, and here you go. There's evidence involved there, quite a lot of prerequisites. But this already shows, I mean, if we have over 50 startups who think they could become a DIGA only from a German market, this is quite a lot, I think. And then this field is also open for the European market, coming back to the points that have been mentioned earlier, that from a European perspective, the German market becomes more and more interesting, also due to the changes going on.
Super, thank you.
I would say that digitalization in healthcare is so important because it can democratize healthcare overall. The healthcare system directly spends 380 billion per year. That means 1 billion per day, or even more than 1 billion per day. Round about 70% is for chronically ill patients. And if you really look also in this chronically ill patient sector, you might say, if you think about genetics and also on, it's maybe 20% comes to patients who can't do anything about their diseases, but 80% is more or less focused on bad behavior in the past. So if you really find a way to change the healthcare behavior of patients, I mean, like the biggest problems are, of course, like nutrition. It's people don't do physical activities, smoking, drinking, and so on. If you really can change kind of prevention and fostering behavior change, this is one of the biggest steps, and also the holy grail in digital care, because really have to find ways to help the patient changing their lifestyle. And with that, people will become healthier, and it will really help the system to decrease costs and improve outcomes.
Okay, thank you very much. We actually just received 2 more questions. Are you guys up for it? We might overdrag. The first one is quite interesting. It might be quite difficult to quantify, but how much remote, so like how much RPM, so the remote patient monitoring processes and devices are in use in Germany? I guess this would be a guesstimation on our part.
Not too much, that's all I can say, but I must admit, I do not have an exact number. It's hard to guess. It's
Happy to quantify.
I mean, I just read.
Yeah,
about,
sorry, Anna.
So the numbers I have in mind is just that we have a raise on like video consultation of like 15% of the people who have now by now used it. 15. And of like, I don't know if the question is really how many providers are there or like solutions are offering it, or how much remote patient. The devices number also not so sure, but I know that for example, in ambulatory care, a lot of doctors use use all the telecare softwares, etc., on their private laptops, for example, not integrated in their information systems. due to security reasons or like feasibility reasons, etc. This is also quite interesting. And I just saw another question. It kind of plays into it because there's always this hardware-software problem, chicken egg problem. I mean, I want to use the software, but then it doesn't fit into my existing software I have, and also the hardware. And then I want to do the consultation on my laptop and not on my computer in my practice because it's not in my hours. So this is very practical problems, but this is just what shows the reality we are encountering currently. And I think we just need to have a little bit more patience for like these processes in the DGAs to be like having a good process also to prescribe DGAs, because this is by now quite an analog format, which does not really make sense. So we see all these mix of like old and new world, and I think this is just takes some time.
Yeah, I guess that also sort of linked to the last question that was asked. What are the main obstacles to digitalization aside from being anti-digitalization? I guess we did cover this. Or any last thoughts that come up to your mind? Any last obstacles? It can be very operative on like a day-to-day, but I guess the like hardware, software, what you mentioned is a very valid point on a very basic level.
Yeah, and this is with all change processes, it's the human factor. So like behavior change, as Jeremy said, this is something that's not as easy as it sounds, and same for like having established structures. And I mean, this all again comes back to the care providers. I'm thinking if there are any other processes areas. I don't know, what do you guys think?
Yeah, I think human factor, after all, is a massive factor. Like from every side, if not only from the startup side, like every startup wants to be as agile and quick and as disruptive as possible, but maybe the idea isn't that good. So they want to do something which they will never be able to, or just human factor also, that the development process itself of a good product, which as I said at the beginning, will be able to really solve a problem and like an existing problem. It's not that easy to develop this product. It takes a long time. It takes many people working on this, and it takes a lot of time to improve it until you are at a point where it actually has this benefit you're looking for. And of course, like, this isn't an obstacle, but it's just a reason also why it takes time, why we're not there yet, also due to other reasons like regulation, etc. But it is a work in process. The road we're walking, and we still need to walk quite a bit and actually develop something which is able to solve the problem and be accepted by care providers, by doctors, and by patients.
Super. And I guess this has hit the 8 o'clock mark. We don't want to keep everybody, I guess, too long. Thank you so much for your input, guys. That was extremely insightful. Thank you very much for taking the time. Thank you very much on the audience side for partaking. And we hope we can do this again soon. Stay happy and healthy and safe and sane.
We will. Thanks, Bijan.
Thank you very much, Anne. Thank you, Lara. Thank you, Jeremy.
Bye-bye.
Bye, Jeremy.
Bye-bye.